Hello, 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 everyone. I am Dr. Teresa Jacobs. I am a family medicine doc, and I have worked for community health centers probably for just about 30 years. Before that, I was a microbiologist and did that for about 15, 16 years. Still have a degree in microbiology. So that's why we're going to talk about hantavirus. I'd like to welcome everybody to the podcast. It'll be a short podcast. It's not going to be very long. Just have had a lot of questions about hantavirus, and I just want to go through some of the more frequently asked questions, just so that we can clear up any concerns that you might have about it. I do want to thank those of you that have, with your well wishes for my back surgery. I'm doing well. We're about 9 weeks post-op, and I'm doing extremely well. No, not with the cane anymore or the walker, doing physical therapy every day now, so all is well. But let's talk about our topic at hand today, and that topic is hantavirus. So it is one of those old viruses, and when I say old, well over 70 years we've known about it, we've studied it. We don't have a vaccine for it, nor do we have any antibiotics for it, but we do can do what they call symptomatic care. But let's talk about it, because one of the most common questions, well, where did it come from? Where is it found mostly? And it is one of those viruses that you will find amongst what we call wild rodents. So those are the deer mice that are out there, the rats that are out in the wooded wilderness, rural type areas. And so that's primarily where you would find it at. And it is from that, the droppings, the urine, the saliva that comes from those rodents that can possibly infect humans, right? And so, well, how does that happen, Dr. Jacobs? Well, if you live in rural, wherever, wooded area, and you have wild rodents running around, and say they get into your barn or into your shed, and you go in there and you want to clean it up. And so if you start sweeping where the droppings are, where those droppings unfortunately can cause an airborne, they can become airborne, and you can inhale them, unfortunately, so you can get infected like that. You can stir up, if there's urine from the rodents, you can inhale that as well. If there are feces, a stool, you can inhale that as well. So you want to make sure that before you go out and clean that shed or barn, that you open it up and air it out nicely. Well, I'm going to talk a little bit about what other types of preventions that you can do. Can you come in direct contact with a wild rodent? Absolutely. That can bite you and infect you. So you want to be careful if you have sheds and barns down in wooded areas, because is it in North America or here in the United States? Yeah, it's been around, like I said, for over 70 years. So it's not like it's something brand new. Now, so that's how we get it from a rodent to a human being, right? But what about from person to person? How does a person get it? Well, believe it or not, that's something rare that would happen. And there is a rare strain called the Andes strain. It is the only one that we know of that, if a rodent is infected with that, gives it to a human being or a person, that person can then spread that to another individual. So, how do you get it? In close contact with that person, prolonged contact with them, sharing bodily fluids. If you're coughing, sneezing, not covering your mouth when you cough or sneeze, you can get it like that as well, in close contact with an individual. Symptoms can generally appear anywhere from a few days up to about 42 days, believe it or not. And that's why you see or you hear about all these folks here in the United States that are in quarantine up to 42 days because they want to make sure that they stay asymptomatic. What are those symptoms? They're more like flu-like symptoms. You'll get fevers, chills, muscle aches, things of that nature. Some folks will get headaches and dizziness, and so basically flu-like symptoms. And it could be any run-of-the-mill virus, right? It could be flu for all you know. But if you come in contact with somebody with hantavirus, those are some of the symptoms that you might have. Um, Usually, maybe 5 to 15% of the cases are fatal. And why would they be fatal? Well, it can affect the lungs. All right, and shut those lungs down. But it can also cause something called hemorrhagic fever. And that's when it affects the cardiovascular system, shuts it down basically, and it shuts down all your organs. So you get this really high fever and it starts to shut down all of your organs. Fortunately, these are rare complications of hantavirus. Usually we treat it symptomatically, and the vast majority of people will recover from hantavirus. So is there a lab test for it? Absolutely, there's a lab test. But unfortunately, within the first 72 hours, it's difficult for that test to be positive because, again, the body has to build up those antibodies. So it may take longer than 72 hours. So the first 72 hours, they'll test you. But after 72 hours, they'll test you again to see if you become positive for the virus. All right. So there's no vaccine for it. There are no antibiotics. So it's just supportive care that we do for folks. So I mentioned we talked about prevention. And for those of you that in rural areas where you got wild rodents that may be infected with hantavirus, it's good to wear a mask if you're going into that shed, if you're going into a barn. So the question, one of the commonly asked questions, what type of mask would you wear? And this is why you're cleaning up, right? The shed. Now, I'm not talking about going out in public, because I want to protect myself from hantavirus. The chances are you getting it going to a grocery store, doing your regular everyday life, is pretty rare. So we're talking about if you're in an area that's infested with wild rodents. Again, you in rural wherever America, right? And there's a shed, there's a barn, there's a field where they are. So that's what we're talking about. We're not talking about you going to the grocery store or you going to the gas station or you going to the airport because you're picking up somebody from the airport. You're less likely to get it that way because the Andes strain that's from human to human is such a rare thing to occur. All right. And so if you're out in rural where America, it's probably good to have an N95 mask, wear gloves, open up the barn doors or the shed to air it out for at least 30 minutes before you go in there trying to clean anything. Then you can always pour some bleach into those corners that's in the shed or the barn to help kill the hantavirus if it's in the droppings, the saliva, the urine from the rodents. And so if you have holes where animals can come into your home, you want to make sure those holes are patched up, right? So you want to make sure that there are no holes where animals or rodents especially can get into your home. So you want to make sure that you do that. You could set traps, but be mindful because someone's asking that. What about traps? Be mindful of the glue-like traps because unfortunately when there's some traps that you put the glue on and that the rodent will stick to that, but they'll urinate all over everywhere, causing possibly a bigger risk for infection. So you have to be careful with that. Right? You don't want to leave food out in your backyard. If you've had a cookout or whatever, you want to make sure you clean all of that stuff up. All right. So make sure that you do that. Wear gloves while you're out there, mask, and wash your hands once you take all that off. Really good. So let's talk about why we're talking about hantavirus in the first place. There's a luxury ship, very small luxury ship, the MV Hondas. It only has about 80 cabins on it. It is, and it goes all over the world. You know, they got these wonderful trips that folks will take for 14 days, 21 days, 30 days. They go to all these little remote islands. And so it's a small ship, very close contact. And what happened, there were some bird watchers, a couple. They are avid bird watchers. So these folks book an excursion on one of these remote islands to go find or see some rare birds, right? And so it takes them to a landfill, believe it or not. Supposedly, there have been rare bird sightings in this landfill. Unfortunately, it doesn't appear as if they had on the appropriate attire to prevent them from inhaling the hantavirus in this landfill that apparently not only had birds in it, but it had lots of rodents. So we've got this married couple along with another cruise ship person, passenger that went on this excursion. Unfortunately, they were exposed to hantavirus. And when they reboarded the ship, they brought hantavirus with them, unfortunately. And so that's how it got to the ship. All right. So it's not that the ship, because one of the questions folks are asking, well, would you go on a cruise, Dr. Jacobs? I got the hantavirus. Yes, I still will cruise, but you just have to be careful. But these folks brought the hantavirus onto the cruise ship. And unfortunately, with those close, really close quarters on such a small ship, that couple, they died as a result of this. And then another woman died as well. So those were three deaths from the passengers of that cruise ship. And so, but be mindful, it was not. And I'm going to say it again because I got a lot of folks asking, what about these cruise ships? It is not the cruise ship that was infected. There were individuals that got off the ship, came back on the ship with the hantavirus. And so, where are we today? Out of an abundance of care, CDC has are tracing and watching over 40 some odd individuals spread out across these United States. Some of them are in quarantine up to 42 days. It's nice to know that they're all asymptomatic. We had one possible case, but it looks like it was a false positive. And so all of those Americans that were on the ship are hantavirus negative, but they are watching them for up to 42 days, watching them, making sure that they do not become symptomatic. Just purely out of an abundance of care. So, should you be concerned? I would say no. The risk of you getting hantavirus, walking around in everyday life, going to church or wherever else that you're going, is pretty slim to none. All right. What are some of those questions I'm getting? Is this the next pandemic? I doubt it very seriously. Hantavirus has been contained, and it is not like COVID, where it is in the air everywhere, you know. So hantavirus is not like that. It's not that type of virus. So is it safe to go on a cruise? Absolutely. Is it safe to fly? Absolutely. If you want to wear your mask because of some other respiratory type viruses that are out in the air, feel free to do so. That's up to you. But you don't have to, but it's your choice. Is there a treatment or a vaccine for hantavirus? That's another question coming across the screen. No, it is not. There's not a specific treatment like a antibiotic. There's not a vaccine, and so but there is supportive care. And again, the vast majority of people that develop hantavirus or become infected, they go on to do very well with supportive care. Can it be transmitted from person to person? It can, but it's rare. How does it occur? If a person is infected, if two folks or individuals are in close proximity or prolonged contact with each other, you're at an increased risk for getting hantavirus that way. And now somebody's asking, well, how long is prolonged? We don't really know how long prolonged is. It's not a defined time. But if you're intimate with an individual and they're infected with hantavirus, you are at an increased risk for developing it. If you're taking care of somebody that has hantavirus, you're at an increased risk for developing it as well. You should be mindful if you live in rural America, where wild rodents are just what they do, where you are, make sure that when you go out to clean those sheds and those barns, that you open those doors up before you go in, ventilate it for at least 30 minutes. Please, if you it's best to have an N95 mask, wear your gloves, pour some disinfectant into those corners or where you see those droppings before you start trying to sweep it up. Let it sit again for about probably another 30 minutes, and then you can go in and you can clean it up. But make sure you've got gloves on and you have your N95 mask. Now, I tell everybody that universal precautions is something we should all still be practicing, right? That hasn't gone anywhere. If you go into the restroom, please come and use it. Wash your hands, right? If you're coughing, if you're sneezing, cover up so that you're not spreading those germs or those droplets out into the environment for others to be infected with whatever that you have. So universal precautions. And so just want to calm your fears about hantavirus. You're not likely to get it simply because it's not that type of virus, okay? And you're not being in exposed, prolonged exposure to individuals. Now, as I get ready to close this out, you're more likely to get norovirus. That is the virus that you just heard recently that was on a cruise ship, and that's from somebody who went to the restroom, did not wash their hands, went to the buffet, didn't put the gloves on, and they contaminated the food. And everybody that and a whole bunch of folks that came behind them and ate behind them, unfortunately, got norovirus as a result of that. So again, wash your hands. Teach your children to wash your hands. It's just what we're supposed to do when you go to the restroom, when you come out, when you're outside and you come into the house and you're getting ready to have dinner or to eat a meal. Wash your hands. Wash your hands. Okay. Make sure that you do that. If you don't have soap and water, try to keep some hand sanitizer with you every place you go. All righty. Ebola, I'll mention it real quick because I know it's in the news. It is over at the in the Democratic Republic Congo at this particular time. Unfortunately, there are a lot of cases. It's a new different species or strain. And so, because you all know Ebola, we have a vaccine for it and we have antibiotics for it. But unfortunately, this is a new species that they're seeing over in the Congo. And as a result of that, there are some folks that are getting what they call hemorrhagic fever. I explained that earlier. That's you get a high fever, it affects your cardiovascular system, and it starts to shut down your organs. It is now over in the Congo. We don't have any cases of Ebola here in these United States at this particular time. And so I would not panic because we do not have any cases here. Lastly, there is a new strain of COVID that is out there, and no, it doesn't cause worse symptoms, but it does. You can have flu-like symptoms with it. And so just be mindful of that. And again, universal precautions is what I would share with everybody. Keep washing the hands or use the hand sanitizer, cover up your mouth when you're coughing, when you're sneezing. And again, wash those hands, use universal precautions. Good evening to everybody. I just want you to be safe and be healthy. God bless you. This will end the podcast for tonight. I see you, Janet Watts. I see you, Evangelist Valtina. Good to see you all on board here tonight. But be safe, be healthy. If you have a question before I sign off, you can certainly put it in the chat. If not, if I have any advice to anybody, and that is universal precautions. You should be practicing that every day, all day. Make sure your children, your grandchildren, your nieces, your nephews, make sure you're doing that on an ongoing basis. And please, if you're going to a buffet, just wear the gloves. If you don't want to wash your hands, at least put the gloves on before you go down the buffet line. All right. So that'll be a wonderful thing for you. So be safe, be healthy. God bless you, and enjoy your holiday Memorial weekend. Bye bye.